he might be suffering from mucormycosis. And if there is any condition, immunocompromised condition, we should also suspect. And if we suspect, then what to do? First thing, we should look for the clinical features. Clinical features in a patient with COVID suffering from or suffered from just COVID-19 infection, we should suspect that he might have suffering from this mucormycosis. Or in any other condition like uncontrolled diabetes, or some patient get used to long-term steroid or indiscriminate steroid also. And in some other, particularly in our country, I shall emphasize the malnourished people. They are also somehow immunocompromised. Severely malnourished people are also very vulnerable. So in this case, if we see these features in the nose or sinuses, and if the case presents like this, then we should suspect, and we should have a strong suspect that suspicion that he or she might have developed the mucormycosis infection. So clinical features. Look for the clinical features. There may be a congestion, swelling in the nasal epithelium. There may be blackening of the epithelium, particularly in the turbinates. And if we see such things, we should go for diagnosis, and a very quick diagnosis. Because if the mucormycosis is established, then we the clinician have very little time to save him. We have to do very quickly. We have to go on very quick action. So we should look at the clinical picture, just take a nasal material, whatever it is, maybe a swab, it may be a tissue piece or anything, and send for direct microscopy in KOH preparation. And in few hours, they can report what is this by seeing the fungus. Another thing is MRI and imaging. And imaging is maybe a CT scan or MRI. So with these features, if there is any features of sinus infection, or there are some typical features also for fungal infections. There may be an inhomogeneity. Even there may be evidence of bone erosion, bone breakage, also, and other features of sinusitis like this. So if we get a picture of like this, we should go for treatment. We should not delay the treatment. And what is the treatment? We have in this connection, I want to just say one thing, that our Honorable Vice Chancellor has taken a very timely decision and timely to create a guideline for treating the mucormycosis patient. Because yet we have to face, but we can face. We are actually in normal situation in ENT department. We used to get 2 or 3 or like this mucormycosis case in a year. But the situation in our neighboring country is very grave, by this time. So we should be alert for that. And we have created a guideline for this. And we have divided the treatment in 3 headings, actually. First, treatment is the start antifungal. This is what is already discussed, emphasizing liposomal preparation. Mainstay of treatment is the medical treatment. And then you address the other comorbidities. Just control the diabetes and try to improve his other situations. You should modify the steroid use and other things. And then go for surgical debridement. In a very short time, these things to be done. But one thing should be remembered, only surgical debridement without starting medical treatment may be again disastrous to the patient. This may increase the mortality. So first start the medical treatment and then go for surgical debridement. And then surgical debridement, the extension of the surgical debridement in ENT arena, actually, sinus exenteration, and we have seen such cases that entire upper jaw becomes already broken, and it is mobile, so we have to remove this job. So the extension, what is the maximum extension, is very difficult to decide. You have to take out, but you cannot compromise. One thing you cannot compromise, you have to take out all that affected or pathological things. Then it can even, it may involve the orbit. But one thing, when it involves the periorbital fat or like this, and outside the periosteum, you need not to exenterate the orbit. You can just exercise out the fat tissue. And when the orbit is to be exenterated, the ophthalmologist will decide actually. So the treatment is actually multidisciplinary, and it should be a multidisciplinary approach. And but one thing, again, I shall emphasize that the treatment, we should institute the treatments very quickly. Otherwise, we may lose the patient, because the morbidity in this, particularly in COVID situation, is very high. Although we know that in sinus pathology, the mortality is about 40 to 50%. But in other cases, when it becomes intracranial, it is almost 100%. So that's very important. And again, in COVID, I think the reported mortality rates are even higher. In one report, I can say that in India, Mumbai Sion Hospital, they reported out of 24 patients, 11 died within 2 weeks. So this is a very grave situation. So I shall say that with these things, I shall actually, I want to conclude. But one thing I shall emphasize again, that in Bangladesh, we should try to prevent this infection. We are we are not affected like India, and we should be very careful for the prevention. Prevention is the mask, wear the mask, and keep the hygiene. And best way to, what I shall say, the best way to maintain the nasal or oral hygiene is our, we call as Muslim, oju. If you wash your hand and face and nose like this, it's a very, I think, useful. These things I want to conclude. Thank you very much.
মুস্তাক, আমি আমাকে আরেকটা টিভিতে যেতে হবে, 2 মিনিট বলে চলে যাচ্ছি। জাস্ট কল মি।
Now I request Professor Mohammad Sharfuddin Ahmed, Vice Chancellor, Bangladesh Medical University, and former President, 3 consecutive session of Ophthalmological Society of Bangladesh. Professor Sharfuddin, sir, please.
Thank you, Mustaq. Thank you, Professor Ashraf Said, Professor A.K.M. Mustaqdir, who is the President of OSB, our guest of honor, Professor Abha Hussain, President of Asia Pacific Academy of Ophthalmology, Professor Tariq Reza Ali, Dr. Tariq Reza Ali, who is the Secretary General of OSB. I thank all the speakers, especially Dr. Milind Naik and Dr. Utpal Kumar Kundu, and also Dr. Intesh sir. They have presented very nicely, and they have told everything ins and out of mucormycosis. And I hope this discussion today will enrich not only ophthalmologists, all the subspecialty, all the disciplines like ENT, neurosurgeons, and also in my university, I have made a separate specialist group with microbiologists, virologists, radiologists, pathologists, and also internists, and all the respiratory medicine. We have a special group, and today Bidhan has told that we have to set one separate OT. It will be done as early as possible. There are 4 patients. Now there are 3 in my university, and 1 today diagnosed not mucormycosis, that one is candida. So the diagnosis should be proper, and immediate diagnosis and treatment will save the life of the patient. One of the things, nasal trauma is being held by a high flow nasal cannula, and this cannula is causing the nasal trauma. That is another thing which causes this type of mucormycosis. Another thing is a dirty oxygen cylinder, as well as unsterile humidifier water. All these things are also causing this mucormycosis, and we should clean our mask every day. That should not be used one mask every day. So mask is the protector of all COVID and mucormycosis. We will be able to make this multidisciplinary approach in all the hospitals in Bangladesh. Bangabandhu Sheikh Mujibur Medical University will take the lead, as well as we have already told our Beacon Pharmaceutical to at least produce much more amphotericin B in our country, and government has also instructed that should be in the pharmacy or in EDCL, that should be stock. There should be a much more stock for amphotericin B. I think everything is, we are prepared, but we should be with hygienic mode, with protective measure. I hope COVID as well as mucormycosis will be protected in Bangladesh. With these few words, thank you very much for patient sharing. I am sorry that I am to leave for Bangla TV now for another talk. Thank you very much.
Thank you, sir, for giving us your valuable time in your busy schedule. Thank you, sir.
Thank you.
Now I request Professor Ahmed Abu Saleh, Chairman, Department of Microbiology.